For many women, this might sound familiar. Work too much, don't have time to do anything, even meet the right man. Take control, freeze your eggs, they say. That is the mindset of many women these days. A treatment once used for women stricken with cancer to preserve their fertility after chemotherapy, it's now attracting career women who aren't quite ready to leave the workforce.
We agreed to get married as soon as you won your first case. Meanwhile, 10 years later, my niece, the daughter of my sister, is getting married. My biological clock is ticking like this.
Men may not remember this scene years ago from My Cousin Vinny, but women seldom forget it. The biological clock ticking, Mother Nature calling, the pressure, the demands. And now it's going head-to-head with science and technology, taking your eggs one by one and freezing them till the time is right. The battle is heating up.
Oh, it's been ticking since I was like 25.
Millions of women fight the biological clock every single day.
I remember being maybe around my 31st or 32nd birthday, asking my mom, and I was single then.
For 35-year-old Lauren Pace, every year that passes gets tougher.
Here's your thumb.
Especially when the very thing that Lauren wants stares her in the face every day while teaching elementary school children. Why the wait? Like many women these days, Lauren's goal was career first, then a man, then a little one.
I did change careers at the age of 29, went back to school and got another degree, and now I'm in my third year.
The uterus doesn't age over time. Eggs or embryos that are frozen do not age over time.
You can't turn back time, but you can freeze time by freezing your eggs. That's what Lauren's doctor suggested.
If you're not ready and you don't plan to do it in the next, 6 to 9 months, you really should freeze your eggs.
The next day, panic did set in, and Lauren found herself at a fertility clinic meeting with Dr. Shahryar Kavoussi.
It is an option for patients who are wanting to delay their childbearing, basically, if it's for career purposes or if they haven't met the right person yet.
So why are women flocking to doctors' offices to freeze their eggs? Well, maybe this will put it in perspective. Let's say these jelly beans are eggs. At 25, a woman has millions of them. As she reaches 30, there is a bit of a drop-off. At 35, the numbers have gone down substantially. And then here is where the problem lies. As she approaches 40, the chances of getting pregnant is now down to just 5% a month. No news flash for Lauren.
I had done research and read articles, and you see things on TV about, how the egg decrease at 35. That somehow seems like this magical number, sort of a sad number.
With a boyfriend overseas, her best bet is to freeze her eggs. Dr. Kavoussi calls it an insurance policy.
Because it gives them some hope for the future if they freeze their eggs.
That's if an ultrasound determines she has enough to freeze. While there is no direct way to determine the number of eggs a woman has left, there are some indirect ways. One is using something like this, an ultrasound. What they're looking at here is the follicles. Each one is a fluid collection inside the ovary, and each one contains an egg. It's exactly what they're looking for, the egg reserve. And it's off to surgery, a procedure similar to an IVF, in vitro fertilization.
We're able to see the eggs and use a needle to retrieve the eggs.
One by one, eggs are taken out of the ovaries in a simple 20-minute procedure and frozen until the right one does come along, and the timing is right.
I know when the time's right, everything happens in the way that it should.
Until then, doctors say there are plenty of options. It is a fascinating procedure, and I will say there are so many women I talk to who are doing this, but only a handful, including Lauren, who are willing to go on camera, so I applaud her for that. Freezing your eggs, though, is not cheaper by the dozen. The procedure can run $10,000 to $12,000, and no one really knows the success rate of freezing eggs. In fact, some doctors don't think it's high enough to even do it, while others say the success rate can be as high as 35% or even higher. Dr. Kavoussi does tell us, though, that freezing embryos will certainly give you a greater chance.